Ladies and gentlemen, welcome to our medical podcast at MedSynapse. Today, we're thrilled to have Dr. Faisal Nawaz, a Psychiatry Resident Doctor at Amal Psychiatric Hospital in Dubai, as our special guest. He is also the Chief Operating Officer at the Global Remote Research Scholars Program with over 50 research publications in psychiatry, public health, and digital health. Dr. Faisal is a strategy lead at the Clinician Engineer Hub, bridging the gap between medical practice and technology. Join us as we explore the topic of digital psychiatry and its impact on healthcare today. Welcome, Dr. Faisal.
Thank you for the warm introductions, Dr. Nagar. It is a pleasure to be here as part of an exciting discussion on a topic that we are still learning more about as we go. So happy to share my insights on digital psychiatry.
Thank you so much for being here with us today. I'm super excited for our conversation. Before we dive into our discussion, I would like to ask one personal question, Dr. Faisal. What inspired your journey into the field of psychiatry?
Right, that's a question that I often get asked as part of my practice, as well as when I meet other medical students as well along the way. For me, psychiatry was something that I did not quite plan on pursuing at the beginning. It was a discovery, I would say, that was in the best way possible. So early in my medical school years, I had started to discover research on its own. And during that time, through research, I understood that there is a very interesting specialty which deals with how the mind and the behaviors that we have today have a lot to do with our thoughts and our actions around them. And that is where psychiatry played a role in my life, where by doing more research, I understood that this is a field that can have tremendous impact if we are able to see ourselves, especially early on, as researchers or innovators. So that is how I started learning about psychiatry. And then through time, I think through clinical experience, electives, rotations, I got to understand how it is one of those few specialities that truly emphasizes on the physician-patient communication bond. And that is something I always treasured in my interactions as well. So that is something I also really adore about psychiatry, the time we get to spend with our patients and truly listen to them beyond just treating an illness or a diagnosis. We see them as a whole. So I think this is one of those few things that I really like about psychiatry. And there are many more that hopefully we'll uncover during this episode.
Wow, that's truly inspiring. Your personal journey adds a unique dimension to our discussion today. Let's now shift our focus to the topic. I've been absolutely fascinated by the concept of digital psychiatry. Could you please give an overview on what is digital psychiatry and how is it different from traditional psychiatric practices?
For sure, Dr. Nagar. So I think digital psychiatry is something that has become an evolving space in terms of advances in psychiatry. And in very simple words, what it really means is how can we, as physicians, as healthcare professionals, consider technology and its role in augmenting patient care. So the most important thing about digital psychiatry or digital health in general is that the patient care is still at the center of what we do. And how can technology help us bridge that gap or some of those challenges we face? And that's where I think the digital psychiatry comes in, where within the field of psychiatry, how can we better understand, treat, diagnose, and screen mental illnesses in the general population as well as in our patients using some very exciting modalities out there. So it encompasses a whole spectrum of technologies, anything from a mobile app on your phone that looks at mental health interventions to more advanced technologies that are considering virtual reality, augmented reality, artificial intelligence, and many others that are helping us become even closer to our practices as clinicians.
It's incredible how digital psychiatry is redefining our approach. Now, moving on, the integration of technology into psychiatry through apps, AI, and surveys is a game changer. I would love to learn more about how these tools are utilized in clinical settings.
Right, that's a great question. So, what we have noticed, traditionally speaking, is how psychiatry or any other specialty is really centered around the basics of history taking, physical examination. In psychiatry, we focus a lot more on the mental status exam, but essentially there are a lot of processes that happen along the patient care pathway from the beginning. How a patient finds out about the facility they want to go to, how do they seek help, how do they book an appointment, as well as once they have consulted a physician or a psychiatrist, how are they able to continue their care long term as well. And this is where digital psychiatry is changing the field, where we are able to stay in touch with our patients long term. And this could mean through mobile help, through telepsychiatry, through different interventions that require technology to be used, but at a level where everyone can accessibly actually work with technology. So this is not technology that needs to be extremely expensive or too advanced for general populations to afford. And I think that's what makes digital psychiatry very special. We're also in a field where, some examples of how digital psychiatry is used is you can have patient conversations tailored to the patient with the help of technology. Now you've got large language models that are coming in, such as ChatGPT. And these models are essentially helping us in order to have conversations that can be understood by technology. And then the technology actually gives us an analysis using the patient's tone of voice, whether their pace of speech is fast or slow. It's able to focus on the tiny details that are going on during an interview with the patient that helps me in psychiatry to understand their diagnosis even better. It's also helping me track their condition well, where they're able to use mental health apps in order to track their moods. They're able to use certain interventions where we have many illnesses within psychiatry that require rehabilitation support for the patient. And sometimes there may be challenges in going outside, interacting with the environment, social anxiety as well. And sometimes a virtual reality headset can be used here to actually help the patient prepare before they go out and experience very unpredictable situations in the world. So these are just a few examples, as I said, using ChatGPT, using mobile mental health apps for screening, for diagnosis, as well as virtual reality when it comes to helping patients get used to their environments around. So that is just a flavor of digital psychiatry, but there's a lot more that happens behind the scenes. And with that, of course, comes a lot of ethical as well as patient care discussions as well.
It's truly fascinating how these tools are reshaping the landscape of psychiatric care. Now, with any innovation, there are bound to be challenges. When it comes to implementing new tech in clinics, how do you see financial constraints and time limitations affecting the adoption of digital solutions?
Yes, and I think that is the real question we're battling when it comes to digital psychiatry today. There are many great ideas out there and innovations as examples that are already happening around the world. But unfortunately, when it comes to the gap in digital literacy, digital awareness, as well as financial resources in order to integrate such technologies in mental health centers, we still have a lot of work to do in that area. And that is partially because of sometimes lack of funding, lack of understanding, both within institutions and facilities, but also within our own healthcare professionals. So there is a lot of work that I see in areas of resource allocation where potentially organizations and governments need to be able to focus more of their attention and resources towards technology for mental health care. And fortunately, that is something we are seeing given a lot of importance within the UAE. And we're hoping that other countries as well follow along this path where investments in mental health can go a long way when it comes to patient care. The other part is also on a more personal level, where as healthcare professionals, even if we are given the technology, are we able to use it really? Are we able to integrate it within our daily care practices? And often what happens is, due to a lack of training when it comes to using digital psychiatry, it is often pushed away and seen as a obstacle or a burden to being able to treat our patients. And what we need to do here is to understand that this technology is here to help make patient care better. It's not here to replace psychiatrists or to replace mental health care as a whole. And that means more training, more investment, more research into understanding what barriers are still there. One of the important studies that we had carried out a few years back was to understand just a simple awareness of artificial intelligence in healthcare among physicians and medical students. And interestingly, what we found was there was not much of a difference in terms of the interest and willingness when it comes to using this technology, which really shows how within healthcare, when it comes to adopting new environments, new technologies, there's a hesitation that we see within healthcare professionals. So, in my opinion, that's one of the first areas we need to work on before even considering digital psychiatry to be part of our everyday lives.
The doctor-patient relationship is also very crucial in psychiatry. When it comes to online interactions, we would like to know how doctors and patients can connect effectively. Could you elaborate on how this works in the digital space?
Absolutely. And I think this is where psychiatry really has an advantage compared to other specialities, because the way we communicate with our patients can be in many different mediums. Traditionally, yes, we needed a clinic and a clinic room where we're able to talk to the patients, see them, as well as understand their facial expressions, their mood changes. But with the help of technology, now we're at a place where you can hold telepsychiatry consultations, which means through a computer medium with basic internet connection, you're able to see the patient, you're able to understand their concerns deeply while in their comfort zone. Sometimes that's something that really helps us in psychiatry, because when a patient comes to the clinic, they're often away from their natural environment. Whereas if we're able to reach them in their homes, in their comfort zones, we can really see a different dynamic and comfort level. So that's just one area of online communication that we see where psychiatrists can play a role in using digital psychiatry. The other area is also the metaverse, which is something people are really talking about these days. And this is where even telepsychiatry can be enhanced, where we're no longer looking at a two-dimensional screen, but we're looking at a 3D world where you're able to create your own avatar as a psychiatrist, as well as your patient's avatar is created, and you're interacting in real time and creating environments that are going to help you become closer when it comes to the physician patient relationship. So there's a lot of work happening right now in the metaverse space in mental health, including metaverse clinics that are being set up currently. The other area, which has already been there for a while, is with the help of chatbots. So within psychiatry, you're seeing examples of automated chatbots being used with online platforms where someone like you and I could interact with a chatbot initially just to share our concerns. And using a screening method, the chatbot is able to identify what is our main complaint here and then guide us to the right facility, whether it is a primary healthcare center or a more tertiary specialized psychiatry facility. And this way, there's a lowering of the burden on healthcare professionals because there's a triaging that's happening now using the help of chatbots. So that's another area where I think online communication is being streamlined thanks to technology. And then, of course, we've got social media as a whole, which I think is the largest digital platform that we could use as healthcare professionals to be able to reach out to our audience. So raising awareness can now change using digital psychiatry, where we are no longer interacting in mediums where you simply post about a certain topic, but instead create live forums. And we're seeing this example in platforms like X, where you could have Twitter Spaces and create a live interaction with the patient community, and really change the way where it's no longer a physician or a professional led voice, but patients are given their own empowerment and voice as well. So that's another area where I think psychiatrists can leverage social media and technology.
Thank you so much, Dr. Faisal. Your insights are truly eye-opening. Also, it is important to ensure that technology serves as a facilitator of connection rather than a barrier. Now, moving on, the
I
tools.
agree, Dr. Nigar, and just to add on a bit, actually, when it comes to how we see this as a barrier sometimes, what happens is I think we're sitting in a place where um, psychiatrists or any healthcare professional, as a matter of fact, is in a place where they believe I am comfortable the way I am because medicine is working well for years and years without needing something new to be added. And this is very different from other fields like engineering, computer science, where there's constant evolution and acceptance of it. And one thing that comes to mind is, would this technology replace us within the space of healthcare? And sometimes that can be an anxiety for healthcare professionals because they often worry that why would I learn something if it replaces me eventually? And they start to dislike technology instead of accept it. And my suggestion to this mindset and thought is actually to understand that, as you said, technology is not here to replace us, it's facilitating an experience. But what could happen if we're not able to keep ourselves up to date and use technology to find diagnoses faster, earlier, in a more efficient way, we might miss out on giving the right patient care at the end of the day. So this is not just something that is there for aesthetic purposes, but to really help you save lives at the end of the day. And how I see it is, if we do see a future with technology, it's going to be psychiatrists and doctors who use technology may replace those who don't use it at all. So that, to me, is a powerful way of looking at how, yes, things will get replaced, and that's how evolution happens in any healthcare or field and its own. But you need to be upskilling yourself with time in order to be there. If there is a replacement, it's for the better, for the patients, rather than for the bad.
You're absolutely right, Dr. Faisal. I definitely agree with you on this point. Now, moving on to the next question. We know that the tools that help predict suicide in digital psychiatry are super important. I'm really curious about how digital psychiatry can handle the problems that arise when using these tools to predict the risk of suicide.
Right. And I really appreciate this question because this is addressing a topic that is more common than we think. And when it comes to mental health awareness, we do know that there is a stigma around it, and that stigma extends to suicide as a topic as well. The potential impact of suicide not only affects the person who's attempted suicide, but even their loved ones, and it goes on to the community as a whole. So it does become a priority, and that's where digital psychiatry can play a role, where we're seeing interesting examples of how artificial intelligence, including machine learning models, are being used to understand trends within people's behaviors. Sometimes it can be analyzed even using social media content, where the way a certain person posts and tweets around the time of when they're feeling low or when they require help could be caught early on using such artificial intelligence models. And one other way where we could actually use certain interventions is using some of the existing scales in mental health. So we've got suicide risk assessment scales as well as mood and depression scales, which can be used as a fast screening method as well, using chatbots, using telepsychiatry interventions, in order to at least be able to notify whether a patient or a potential individual could require professional help at that point. So the goal of preventing suicide is to act fast and to detect it early on so that the person can get the right support system. Also, I think awareness around it can be better organized using digital psychiatry, where when a patient has been there at your facility, they've gotten the right mental health care, often they're lost after that step. And we often forget that they're still going back into the community. So, using mental health apps, we're able to follow up with them. We're able to track how they're doing later on as well, and give them the right resources when it comes to education materials, using mental health apps to actually educate them. We've also got online psychotherapists and psychologists who are able to offer that help at any point, which I think is very convenient for our patients.
Reaching underserved communities is such a critical aspect of healthcare. How does digital psychiatry bridge the gap and ensure that everyone, regardless of their background, can access the care they need?
Yes, and I really admired this question, Dr. Nigar, because as much as we like to talk about technology in healthcare, we do realize that this is a technology or this is a time where people are not able to fully access this. And that means we're really missing out on a large populations of patients that need this help at the end of the day, especially those that may not be able to afford care, those who are living in remote areas. These are all places where technology can be inaccessible for them. And the question how we bridge the gap actually really starts from looking at things on a more ground level here. So when we talk about technology, it doesn't really have to be at a high scale, fancy, expensive way, but essentially ways in which sometimes we can even bridge the gap between the availability of a professional, because we know in psychiatry that we don't have enough of psychiatrists out there. And this is where technology could help in at least giving the patient some level of education on seeking help. And at least in inaccessible areas, we're able to see some examples where online internet connections are great mediums for patients to eventually reach out for help through. So my best advice for now is for actually building the right infrastructure digitally, at least on a basic internet connectivity level, at least on a level where we have a basic structure in society where people are able to communicate with each other. Unfortunately, we're living in a world where about 1 to 2 billion people are currently using their smartphones. So this is a huge untapped potential sometimes in lower income countries where they have internet connectivity, they have mobile phones that are being used, but often we're not reaching to them. And sometimes language can be a barrier as well. So instead of looking and blaming at just resources and funding, sometimes the simple solutions can be really life changing for people, like introducing more translated materials when it comes to mental health awareness, or creating different ways in which the community can feel connected to the culture that they're in. And we know in psychiatry, culture plays a big role. So using digital psychiatry, we're able to understand concerns within a community and society and create solutions according to that, hopefully.
It's really cool to see how technology can break down obstacles and make things fair for everyone if used properly.
I agree, Dr. Nagar. An additional point that just comes to my mind is a technology that is currently in development, and this is where, on the topic of addressing language barriers, because that is often a significant concern, we're finding even glasses that are being built in with technology that can give you translations to what the person is speaking live through your lens on the glass. And this is something which really excites me because we're living in a space that's very dynamic. In Dubai, for example, where we interact with a very diverse community of patients, this could potentially really change the way the patient understands us. And I think that's another example of how digital psychiatry in the future could change the way we interact with our patients.
Definitely. Now, moving on, privacy and security are top concerns with technology. How does digital psychiatry prioritize safeguarding patient data? We're genuinely interested in the measures taken to ensure the patient confidentiality.
Yes, and that is really an important question because often data privacy is something that exists as a priority within healthcare as a whole. We don't even have to think about technology to think that a patient deserves the most basic principles of confidentiality and preserving their rights and anything that could otherwise become a risk for them in the future. And the same applies to technology as well. I think we're at a stage where everything we build needs to have ethics and the right principles at the core of it And that's a great opportunity for us in digital psychiatry as well. Because of the evolving and new nature of this field, we're able to actually integrate privacy related matters into it from the beginning rather than build the technology first and then start thinking about the problems that can come. So within digital psychiatry, there are measures that can be taken where any technology that is being used needs to be foolproof using cloud based security measures, using privacy protections where a patient will only interact after certain verifications are done with their psychiatrist. Using even facial recognition softwares where we know that the person they're speaking to is a licensed professional. These are just some ideas that come to mind that can help enhance the authentication of how an interaction between a patient and physician works. And I think that's where healthcare organizations and facilities need to be more transparent as well about how they're ensuring that patient security and privacy is always there whenever there's an interaction happening. And we've seen examples where this goes wrong, and that's where we learn from these lessons and actually integrate it better. The good thing is we're seeing data privacy already being an active matter of discussion within society as a whole. So I don't see this being a very difficult conversation when we see in the healthcare space in the present right now.
The pandemic showcased the importance of digital solutions in healthcare. Could you share how digital psychiatry contributed to helping people during COVID-19?
Absolutely, Dr. Nigar. And I think we really understood the importance of technology during a time like the pandemic, where a lot of isolation happened between people, between societies, between governments as well. And that's where we realized that the burden of mental health increased even more during this time, where the number of patients who were being newly diagnosed increased, the patients who were on a particular diagnosis of mental health were also having increased number of relapses and worsening of their conditions during the isolation period. And this is where people realize the need for innovation to come in. And I think it's very interesting how we as a society accept technology even better when we're put in such situations, because telepsychiatry or telemedicine became the norm during the pandemic. People were more open to talking about their struggles because they felt that they were going through a difficult time together. And I think that was one of the unique things we got out of the pandemic. And that also meant mental health support, where people realized that mental health is just as important as physical health. And we need to be able to prioritize that as a society as a whole. We also saw education improving in a way where people are more comfortable and safe in their environments when accessing education. And that meant that they are still continuing with their regular lives. Work from home was an important thing. And to me, these are important things where mental health significantly improves for someone. So the fact that society could help in creating such technologies around that could help sustain the mental health of society, I think that was really beautiful to see during the pandemic.
It's very impressive to see how technology can bridge the gaps, especially during the challenging times. Now, moving on, measuring how much digital psychiatry really helps is probably complicated. What can we do to figure out if it's really making things better for people's mental health instead of just talking about it?
Right. And I think that is another thing when it comes to anything new that's being introduced, we should be able to measure the change it brings. And that also applies to digital psychiatry. And that's why prioritizing research around the technology that's being built is very important. We need to focus on making sure there are outcomes being measured using the technology that we're deploying out there. And this is where we're no longer focused purely on the industrial side of how technology is going to be in the community, but rather the side where do we have evidence that this is helping? And sometimes you've got examples of certain video game based interventions that are being used as prescriptions to treat ADHD in certain populations. And that again is because of enough research being done to see whether this can be used as an important intervention to help bring down the symptoms in certain disorders. So this is one example, and I believe that we are at a place where the more we are able to see the change it brings, the more convinced society would be, the more convinced healthcare organizations will be. But that also means we should be open to be able to experimenting with new innovations coming in. And that needs to be done in a safe environment. That needs to be done in a way where there are protocols being followed, and hopefully enough education around how can you build and deploy your own ideas out there. Because essentially technology, as we mentioned, can be something as simple, and doesn't have to be extremely complicated. So how can we look at ideas around us? And that's what we call social innovation. So in your own society, how can you find areas for change? How can you create technology based solutions? That kind of mindset needs to come early on within our psychiatrists, within the community, within stakeholders. You only know what you can see in that point. And if I don't know something, I'm probably not going to see it either. So that brings the point where digital literacy is very important. And perhaps medical schools, postgraduate programs need to start educating their populations on what is it that creates a good technology out there, and what is it that we should be avoiding that does not cause any harm to our patients in the future.
Training the next generation of doctors in using digital tools is a significant aspect. How is medical education adapting to incorporate these tools effectively into psychiatry training? I'm excited to learn about this evolution.
Absolutely. And I think that is something where we saw one of the first changes coming into how technology can shape healthcare, and that came through medical education. Medical education took its own turn during the pandemic, where people had to really think outside the box when it came to accessing education. And as we mentioned, there have been lots of ideas out there, and some of those ideas even continue till today, even though we're outside the pandemic phase. And that includes, digital education, online courses, blended learning techniques where you're using hybrid ways in which some of it may be in person, some of it is online, as well as ways to encourage more interactions using the metaverse for education. These are all ways in which technologies are used within medical education today. We're also seeing simulation based environments being created to practice maybe anatomy dissections, creating rooms where medical students can discuss around certain topics virtually, video games and gamification, where these systems are being used to create interactive and fun environments for medical education to take place. And then certifications online, where technology can also be used for upgrading your own current skill set. And a lot of students currently are enrolled in multiple courses beyond just medicine to be able to make sure they're a well rounded doctor by the end of their medical school experience. So these are some examples we're seeing where technology is enhancing medical education. What we need to understand now is, in the next step, how will this technology help the educators of the future adapt to medical education? Because we have the technology, we have the resources, but the way the training is being done using the technology is also very specialized. And we cannot just think through the same lens of a classic traditional classroom anymore. We need to think of a way where there's enough awareness and education within teachers, within professors to adopt such technologies. So that's currently where I'm seeing the future of medical education heading. And we're already seeing a lot of talk and programs built around it. And hopefully that is going to be more common in the future.
Thank you so much, Dr. Faisal, for this incredibly insightful discussion on digital psychiatry. As a fellow doctor, I'm genuinely excited about the potential of these innovations in shaping the future of psychiatry. Thank you so much for being here with us today.
You're most welcome, Dr. Nigar, and it is a pleasure to be a part of such an exciting series of podcasts. And hopefully, this inspires more people to consider the world of digital psychiatry and maybe become pioneers in advancing the field further. And I hope that the series just grows on to continue the awareness that you are raising as an organization. And it's a pleasure to be a part of that change.
Thank you so much, Doctor. And before we end, I would like to remind that this podcast was made possible by MedSynapse, your getaway to a vibrant community of medical professionals. Join us as an active member on MedSynapse platform where you can engage, discuss, share, and exchange knowledge with doctors from around the world. Thank you for joining us, and goodbye for now. Until next time.